So genetic testing is a wonderful tool. Please, whoever sees this YouTube, go to the doctor, ask for it. It's many ways that can help you, right? And that will change your life, will make you actually more aware and more in charge of your own destiny, right? You don't give your life to someone else to manage. Be in charge of your life and start looking at other ways that you can do.
Mm-hmm.
They're free.
Yeah. They're 3 you're saying?
They're free. I say, I tell my patients when they come, this is what I want you to do if you want to. You have a yard? Yes. Well, I want you to go every morning outside, no sunglasses, read the newspaper, read the Times, I don't care. Take your shoes off, put your feet on the ground, on earth, and stay there for 45 minutes. So what I'm doing is two things. And the bottom of the feet is kidney
Grounding.
1, which is a powerful point to create energy. You get energy from earth, which is one of the elements, right? And at the same time, you allow the sun to decrease the melatonin during the day and increase it at night so you can sleep like an angel. And the reason why I became an integrated medical practitioner is because in this culture, like in any other culture that has Western tendencies, the medical schools teach us the entire pathology, mainly physiology, which is the foundation, but also how to prescribe. And I noticed many times the delivery of medication was so free without taking in consideration the person in a holistic way. I'm not criticizing the doctors. Medication are extremely important in several occasions, but we need to learn about the biodiversity that the individual has more than prescribe medication, doesn't work, let's change for another one, doesn't work, let's change for another one, without taking in consideration that sometimes the medications, besides creating side effects, sustain or prolong the pathology that the person presents, right? So based on that, I say, well, I want to do something different. So I went to TCM school and became a doctor in Oriental medicine, because it's easy for any physician have the tendency to think that we know it all, but we don't. And it's like in the situation with the patient, physicians are empowered. I'm powerful and I'll tell you what to do. And the reality then in a holistic way is more about, let's work together. Let's do things together. Listen to the patient and see what works and doesn't work. That's the reason why I do more integrative medicine with co-occurring disorders mainly.
That's fantastic. There's so many questions that come up, but let me just throw a few of them at you. First of all, is a more visceral question of, was there a lightning bolt in your life where you said, this is what I have to do? Because, I mean, the work that you're doing is incredible. It's helping so many people.
I don't think that was something that clicked. I think it was a pathway that I'm supposed to do. I believe in a higher power. I believe that I'm an instrument from an energy that is powerful, more powerful than we are. And I believe that things happen because caused my curiosity to think, this person is taking so many things, it's not getting well, right? And then something has to change. And a lot of people look on Eastern practices, which are not well accepted in the United States, and in specific areas, maybe New York, California, Texas more, and very pushy. So I introduce that even when people don't like it. I'm like, no, we go different ways. And that's what really happens. And the last job that I have, I was hired because I have that knowledge, because I was able to do more Eastern medicine with patients that were dealing with pathologies like addiction and major depressive disorder or anxiety and cocaine use. That is what I'm so much propense to request to medical practitioners to do for example, genetic testing. I notice in this culture, if, let's say, I have depression, I go to the doctor, well, let's give you Zoloft. Well, doesn't work. Prozac doesn't work. Baclofen. And I became an ambulatory pharmacy, which is very costly because the pharmacy in this country, right, the industry of medication, making millions of dollars. And not many people has the access to those millions of dollars to pay for expensive medication. So I opened a TCM clinic. We have like 4 rooms, and we did a lot of work with the patients with TCM. It was amazing the changes that we saw from the mental health, physical health, attitude, behaviors. So that was my first step to do integrative care, right? Helping people that were indigent, no money to medication. So we started incorporating more. And it was a wonderful experience to the point that with that step, I was invited to go to Tijuana, and I go to Ciudad Juarez, and I go to California and do some education and teaching about how we can integrate care. And that's why I have so many referrals from psychiatrists, because they know that I working in collaboration with them, and after the patient sign a consent, so I can talk to the doctor, I discuss with the physician, what is your goal? What do you want to do with this? Let me tell you, how can I help you, and you help me, to help the individual to go back and restore their life. And that's what I always talk to them about genetic testing, because it's something that not many people do, right? Medicine has advanced so much. So why not integrate the technology and what medicine is doing with things that are for ages and centuries and work well? Every part of the patient is important: physical, emotional, spiritual. And that is, as we all should see each other, right? So that's what I say, it's not just physical, it's emotional, how we trigger the emotional part to be in balance, how we trigger the spiritual part to be in balance. And always consider the body individually and the multidimensional health that we all have. In that sense, when I have a patient, the first question that I ask is, have you been done genetic testing? And this is a slide that is talking about that. So the genetic testing is related to, let me see if we can see that slide. The genetic testing is embraced to determine what medication works better. So within the alternative of treatments that we have in overall in co-occurring disorders, usually patients come to me with already medication in place. We do cognitive behavior therapy, dialectic behavior therapy, motivational interviewing, which is an exceptional methodology of care, individual family therapy, which is extremely important overall with someone who has co-occurring disorders, group therapy, which is the enhancement of each other by sharing experiences, a lot of education. And then for patients who have trauma, EMDR and ART, accelerated resolution therapy, and eye movement desensitization resolution are important. Now, in the last probably 10, 15 years, TMS and MERT have been part of the Western practice of care, and we can talk about that. But my point is, let's do integrated care. So that's what I receive patients from another physicians. So when I ask, do you have genetic testing? It says, no. I say, okay, let me talk to your doctor. Many doctors are not aware. They know that it's around, but you know what? It's not much education about that, right? We are so immersed on seeing patients and file insurance and help the patient to get well that sometimes we lose the little tiny things. That is, look for the genetic information to predict how the patient is going to respond to a specific medications, right? Based on that, then the physician and myself, we can do a nice treatment plan, right? That will be just for that individual. That is bio-individually. Okay, individuality, which also reduce the risk for adverse events and maximize the therapeutic effect. So the issue of genetic testing is about helping the patient to get better sooner than later, right? you get an incredible report. You get like 5 or 10 pages of the report that tells you about how cytochrome 450, which is an enzyme from the liver, they catalyze reactions that in the body that involve the metabolism of different drugs, right? Hormones and substances. So the P450 is what tells us Zoloft is not going to work with this patient because it's resistant, it's a poor metabolizer. You need to go for another SSRI. So
thank you.
It's an incredible, the cytochrome P450 is incredible because it gives us so much information. They give us an important role of the metabolism of the drug. Is the patient a fast metabolizer? Is a slow metabolizer? Let me tell you, when you go to the physician and they prescribe medication and they say you need to take this drug 3 times a day, right? Or 2 times a day, I notice that many patients decide to become the other physicians and take the medications as they want to. Well, the pharmacokinetics are extremely important because each drug has a half-life. So you want to sustain an optimal level of medication in the system to see the effects. And many times we don't see it because the patient don't follow the recommendations. Why? Because in reality, they're resistant to medication. I see that many times with actually distort thinking on my patients who are drug addicts, and they say, I don't want any drugs. I say, well, you're taking cocaine and opioid. Well, but it's different, right? So, and that time is when you change the irrational beliefs and you help the patient to go a different pathway. So manage the patient actually with much more precision, right? Reduce actually the healthcare cost. Absolutely. It becomes more cost-effective, okay, and improve the patient and the healthcare provider and satisfaction level, right? So it's like, okay, I'm working with this doctor knows what he's doing. Well, he knows what he's doing, besides having the knowledge of how to treat you. He has a blueprint of who you are. And that's the print that we all should be able to use in order to help the patient get better. The pharmacogenetics testing, which is this company is doing, actually turns the data that you have, turns information to the doctors to do a very good treatment plan, right? So that tells you how much doses you will have to take and how the medication is going to work. The nutrition, how the food is the best medication that you can have. How breathing, look at how simple it is. The breathing, something that our central nervous system does automatically, how we can be mindful and breathe different to produce less stress, right? How you measure your food intake. One of the things, unfortunately, that we do in this country is like we work and work and work and work. Sometimes people don't take breaks, don't take the lunch. One of the most important things that we need to do, you will think is crazy, but is chew your food as much as you can. We don't chew, we swallow, right? Because we're always in the rush. So by chewing the food, you allow your stomach, which is an extremely important organ, to digest everything without problems, without having. How many times we hear, oh, now I need to take a nap after eating? It's because we swallow it and we don't create a process, a metabolic process that's going to help us to digest the food, digest the vitamins, digest antioxidants. I ask in my patients to reduce the coffee in the morning and start having a smoothie. Actually, I have a patient yesterday that says, Dr. Mendez, you give me the list of smoothies I can have. I have more energy than I ever had in my life. Well, the smoothies are all organic antioxidants, right? Strawberries, blueberries, raspberries. I put a little bit of collagen, right? So, and they start, for curiosity, they start using it, they engage and love it, and it's much more healthier, right? So it's different things that can be done to support you naturally. Hay 2 cosas que se pueden hacer muy fácilmente que en general nadie lo practica. ¿Cómo respiramos? Breathing, right? La respiración en Chinese medicine, los pulmones están a cargo del sistema inmune. It's extremely important. Y está a cargo de manejar la piel, que es el órgano más grande que tenemos. Entonces, si estimulamos el pulmón de un modo natural, ayudamos al sistema inmune y prevenimos muchísimos problemas. La respiración depende del sistema nervioso central y es autonómico. Nosotros no pensamos respirar in, respirar out. Pero creo que parte de los cambios tiene que ver con estar en una situación more de mindfulness, estar más concentrado en las cosas que hacemos y cómo las hacemos.
Que está muy bueno saberlo porque uno por ahí piensa que está eligiendo bien y como no tenemos esta clase de educación, no nos damos cuenta que no nos estamos eligiendo a nosotros.
Exacto, eso es, uno tiene que elegirse primero, I'm first. Y si, cuando vienen madres a verme y dicen, mi hijo, y me encuentran la situación de la familia, le digo, usted tiene que hacer lo que pasa en los aviones. No sé qué pasa en los aviones. Cuando la presión baja, tiran las bolsas y usted respira primero. Y las azafatas te dicen, póngase la máscara primero y después ponga la máscara al otro. Así es la relación. Cuídate primero, ten tu cuerpo en balance y luego ayudas al que esté al lado tuyo, tu esposo, tus hijos, tu cuñada, que fuese.